I think stem cell therapy is still evolving. We're still very, very early. After they just discovered that there was embryonic stem cells, or there are actually stem cells circulating the blood. And at first they thought that's the only place where we still have stem cells left. And then they realized that there's stem cells everywhere in our body, in all our tissues.
Let's ditch the quick fix and dive into today's conversation. Welcome, everybody. My guest today is Dr. Joy Kong. Dr. Kong is UCLA trained, triple board certified in psychiatry and neurology, addiction medicine, and anti-aging and regenerative medicine. She is the president of Uplift Longevity Center in Los Angeles, California, where she specializes in stem cell therapy, ketamine therapy, as well as a wide range of therapeutic modalities to enhance overall health and combat diseases in a holistic approach by enhancing the body's innate regenerative potentials. Dr. Kong believes in advancing the field of stem cell therapy through education of both physicians and public in general. In addition, Dr. Kong is the founder and CEO of Charo Biologics, a company dedicated to providing cutting-edge regenerative medicine products in the US and to the global market. Dr. Kong has developed the most potent and comprehensive stem cell product in the country with a patent-pending formulation. Welcome, Dr. Kong. I'm really excited to have you here today.
Thank you so much, Damon. I'm so happy to be here and sharing some information with everybody.
Very, very good. So yeah, why don't you just kind of elaborate a little bit more on your background there? A pretty extensive background, a lot of areas of interest that each one by themselves would be a career. So.
Yeah, that seems to be the story of my life. Coming from China, I lived for 20 years. My first 20 years in life was in Beijing. And of course, that had an impact on my view in medicine, because it's kind of came as something natural, that incorporating various modalities or looking at the body as a whole, as an interconnected system that is entrenched in Chinese medicine. So I've always searched for that connectivity and that holistic view of the body, even though I went into Western medicine training. So that never left me, because I know how powerful and I know it works. So when you have experience in your life and in your own family, seeing how that kind of approach can work, so that it's very powerful. And I always wanted to bring that in to what I'm doing here, even if I'm doing Western medicine. So yeah, I love the brain because I love a challenge. I just think it's the last frontier that we have no idea. And went into psychiatry. It answered, various questions, but of course, that's just based on what we know so far, about consciousness and
Sure.
Which is not very much. So, but still, it's an interesting education and talking with people, and did a lot of medications, and went into addiction medicine. Not really happy with the current model of treating addiction, and realizing that we are very much behind what could be accomplished, because coming to know what's known now as functional medicine, or anti-aging medicine, there are a lot of tools available that is not utilized in the practice, day-to-day practice in medicine in general. I would say 95 to 98% of the medicine practice in the US really is far behind what current science says. So, at least 15, 20 years behind. So we're not utilizing the most up-to-date information. And that's really unfortunate. And I love how open and how progressive this whole functional medicine, anti-aging medicine is, because you're incorporating all the new evidence and new information into how you take care of people. So that's kind of what changed my direction, switching from doing a conventional psychiatry to embracing anti-aging medicine and stem cell therapy is kind of a big portion of anti-aging medicine. It's regenerative medicine. So that was very, very exciting for me because it's incredibly holistic. I can't think of anything more holistic than utilizing the intelligence that created us to heal us. And that's just really powerful concept. And not only in concept, but in real life that I saw when I started to treat patients using stem cells. The results were pretty astounding. So that, that is incredible combination, right? Intellectual satisfaction and real life successes. So that makes medicine really fun. So that's kind of where I am now.
Boy, there's a whole lot there, and there's about 4 or 5 rabbit trails that you could take me down as you shared that. The conversation of consciousness is one of those very deep conversations for sure. But ultimately, what you're kind of hitting on is, Western medicine, unfortunately, has brought the balance out of balance between what nature has to offer and what Western medicine has to offer. There's good things about Western medicine, especially the emergency room and the way they take care of people that are in acute distress, things of that nature. But the balance is just way, way off. And there's so much there available in nature for the health of the brain and the body, for sure. And so, I wanted to definitely get into the stem cell conversation. And typically from my professional experience, I'm looking at stem cell options for patients for biomechanical reasons, the joint structures and things of that nature. But you're kind of talking about also having a benefit for the brain as well with stem cell. So why don't we start there? Why don't we start a little bit with the brain and then kind of go from there? I guess one is, what is stem cell therapy? And then its application specifically to the brain, just to kind of get going.
Yeah, I think stem cell therapy is still evolving. We're still very, very early. So that, after they just discovered that there was embryonic stem cells, or there are actually stem cells circulating the blood. And at first they thought that's the only place where we still have stem cells left. And then they realized that there's stem cells everywhere in our body, in all our tissues. So there are different types of stem cells we can utilize. Of course, people know about embryonic stem cells that were banned by Bush, and research is still going on, but you can't use it on people. So that's one type. And in the human body, you can get stem cells, from your own tissue, or you can develop new stem cells. Using embryonic stem cells, but that's again is only research allowed in research. But you can also obtain stem cells from very early tissue, such as the placenta and the umbilical cord, and these are obtained when the baby's born. So it's not like you are using aborted babies. That's a common misconception. I don't know anybody that's using aborted babies. Maybe if you go to Ukraine, they do use fetal stem cells, and it's not pretty. And I don't think the way they're doing it is that scientific, but that's not what you can get in this country. What's conducted in this country utilize, if they use birth tissue derived stem cells, is always from live healthy births, and then the usual placenta and umbilical cord is tossed in biological waste usually. But now we know they're powerful components that we can get we can extract. So and from those tissues, you can get various cell types. And they're all helpful. And this is one reason you mentioned, my company, Char Biologics, which is why I wanted to provide a product that utilize different cell types. So instead of just hammering on mesenchymal stem cells, which is the darling of stem cell therapy right now, doesn't mean it's end all be all, but right now is the most sought after, and it's very powerful. I love MSCs, but other cells are there for a reason, right? I always say God created everything for a reason.
If you've listened to this podcast, you know how often ozone therapy comes up. I personally have the Simply O3 Complete Kit and use it as a preventative measure or when I come down with something. So whether it's ozone therapy at home or in your clinic, Simply O3 has equipment for your needs. If you are healing chronic illness or biohacking for optimal health, Simply O3 will make getting started with ozone therapy super easy. Go to simplyo3.com or call 844-655-2524. Use code FIX to get 10% off. That's www.simplyo as in oxygen 3.com.
I don't really want to play God and thinking that I know exactly what cells is going to do everything. And if you talk with the best stem cell scientists out there, they will say there's no one cell type that's good for every condition. So everything is there for a reason. You know, some things are better for some things and others. So
still a bit of a learning curve there.
Yeah. So there are a lot of published data on different types of extractions from the birth tissue. There's, from the umbilical cord tissue or umbilical cord blood or amniotic membrane. Sometimes people use amniotic fluid, which has very, very few cells, almost none, but you get a lot of growth factors, but I wouldn't call that stem cell therapy. It's, it's a growth factor and exosome, that's what's in there. There's also the other camp, which believes that you have to use your own stem cells. And that is a pretty outdated concept. And I'm surprised still, because I just heard, went to a recent biohacking conference. That's what they were saying. I was like, oh my God, this is so, so in the past, maybe 10 years ago, you can make the argument, but now that just doesn't stand, because that's the whole point of my presentation. I mean, I started giving a presentation about 5 years ago. It's called Are All MSCs Created Equal? So I went into the scientific literature and looking at all the comparisons between the potency, the therapeutic benefits, and the cell types, and from either a person's own stem cells, own tissue, so that would be either fat derived or bone marrow derived, or birth tissue derived stem cells. So it's a 40-minute lecture. I put it on the on YouTube. Are all MSCs created equal? I go into study after study after study. It's really, this is never about my opinion. I'm trying to share what science has discovered, because people have been trying to answer this question: what is better? What should we use? So the evidence, when you finish the lecture, when you look at all the evidence, to me, there's no question that birth tissue derived stem cells are superior. You're not only going to get a more potent therapeutic benefit, you're also going to reduce the chance of side effects, because first of all, these young cells don't really cause tissue rejection because they have very little surface markers that actually mark them as foreign. And plus, MSCs specifically help calm the immune system. So you can use MSCs along with tissue transplantation, right? Organ transplant to reduce the rejection rate. So they modulate your immune system. So in combination of the fact that they are what's called immune privileged, that they don't really have the surface receptors to mark them as a separate individual, and because they're very, very young, but they also modulate your body's response. So they don't really cause rejection. Really is not an issue, especially if you have adequate amount of MSCs. If you only use cord blood derived stem cells, which has very few MSCs, you may have potential issues, especially if the product is not pure. And I know, like in Duke University, they have to pre-medicate people with some steroid before they do the cord blood transplantation. And I just think it's unfortunate that they're not adding the MSCs, because it could really help reduce the amount of side effects. And besides MSCs and those hematopoietic progenitor cells in the cord blood, they're synergistic. So it actually helps engraftment. And then this is why I'm a proponent about synergy. You want to utilize all the intelligence that's in the body. You don't want to just have this hubris that I know what's best for you. So this is what I'm giving you. That's a very reductionist Western approach. And I really, really would like to see people getting away from it, grow up from that limited
Yes.
concept.
Yeah, makes sense.
Yeah, so that's the kind of people may not know. Not only your own stem cells have decreased potency because it's been with you all your life, it's accumulated all these damages from environmental toxins you've been exposed to, mitochondria decline and the DNA, degradation. So you carry all that with you. So not only they're not as active and potent, but they're also losing some of their intelligence. I call it cellular dementia. So when a young MSC sees a tumor cell, right, a abnormal, or precancer cell, the young cell will recognize, hey, you don't belong here. There's something really wrong with you. So I'm going to tell you to die. So they will send particular signals to trigger programmed cell death. But the cells that are in a 60-year-old, 70-year-old, 80-year-old person's body,
They become desensitized to it.
they don't recognize. They're
Right.
like, oh, my job is to make everything grow, so
Yeah.
let me send you some growth factors, and all of a sudden now you're
Cancer
getting
grows.
exacerbation of cancer. So this is not just a conjecture. This has been shown in studies.
Gotcha.
Side-by-side comparison of using the glioblastoma cancer, both in the petri dish and on the animal model, on the animal's body, when they put side by side, using either the cells from fat-derived stem cells or umbilical cord-derived stem cells. In both cases, when the cancer cells was next to the fat-derived stem cells, the cancer kept growing. It grows bigger and bigger. Where when it's exposed to the umbilical cord-derived stem cells, the cancer actually shrink and start to go away. So that's how powerfully different they are.
That is very, very interesting. And so the stem cell therapy obviously is more efficient with the younger cells. And is that inclusive of a younger person? Like, we're talking about umbilical and or placenta use for anybody at any age, but how about a younger person that might need stem cell therapy, somebody in their teens or their 20s? Is it still better just to go with the umbilical placenta?
It's still very helpful. I've helped a lot of kids with autism. So, as young as age 5. So definitely, there's signaling defects in these, in these people who are seeking stem cell therapy, because, if everything is functioning perfectly, then they wouldn't be sick, right? So they may need some extra signals to help the body repair. So that's where the stem cells come in.
Very, very interesting. So going with that kind of thought line, and you kind of touched on it, you're treating what type of patient? Again, it's not just knees and shoulders. What is the kind of the broad spectrum of patient care that you can utilize stem cell therapy with?
Yeah, so that's definitely an area that's very exciting, because people come to me, from all around the country and the world, with all kinds of, difficult conditions, ranging from, various autoimmune diseases like rheumatoid arthritis and lupus, psoriasis, to neurological diseases. I think neurological disease is more challenging for sure. But still, that's, people can get, some solid improvements and help from it. So neurodegenerative conditions, like MS, traumatic brain injury, well, that's a trauma, but that can lead to neurodegenerative disease. And, Parkinson's and ALS and dementia. And then I treat patients with like COPD, lung conditions, liver cirrhosis, so liver pathology, kidney failure, heart failure, and so basically all the organ repair. And then there's dermatological conditions. So literally every organ system, some eye conditions. So, but definitely some conditions respond more easily and faster. So musculoskeletal is like the bread and butter, is the easiest one to treat. because it's, the repair is so rapid, the cells, that's what they do. They go in and remove the debris, break down scar tissue, and promote generation, the growth of new healthy tissue. So for other more systemic issues, it may take a little longer, maybe a little bit more challenging, but still, I see that as offering hope that very few things can. So autism is definitely one of those that I've seen good improvements that people get. I think it's, autism is such a complex condition, has so many causes. And that speaks of the beauty of stem cell therapy, because it addresses many causes all at once, from the immune dysregulation, the lack of oxygen in the brain, gut dysregulation, the gut damage. So it can address many things all at once.
So yeah, I didn't realize it had that application with autism and neurodegenerative diseases. That's really, really exciting to see that there's some opportunity there. When you're using stem cell therapy for neurodegenerative conditions, what would that look like in a general sense? I mean, what is the treatment protocol kind of in a typical sense, and what is happening? You kind of touched on it a little bit, that when you get these younger stem cells into the body, it basically is recognizing, foreign and or pathogenic processes within the body. So how many treatments, does it take to kind of get, something like, we're talking about cancer, talking about neurodegenerative changes, to get the body to start to stabilize, and what is happening in a certain surface level physiological way, when you get the injections going?
Yeah, I think, being in medicine, that everyone responds to treatments differently. So
right.
I can see one person achieving incredible results with one treatment, and somebody else may take 3 or 4. So I generally tell people, if you have a severe condition, we may want to consider 3 treatments as a series of treatment. So at least 2. To expect one to do miracle, that's unrealistic. Not that it doesn't happen for some people, but it's unrealistic. And it would be a missed opportunity if I just say, okay, let's just do one and see if it helps. And if it didn't, it doesn't mean the second treatment is not going to get you to a good place. So
right.
I would
Very
say,
individual.
Yeah. So if you have severe health issues, we should do, at least 2 to 3 treatment as the first treatment course. And I usually space them 1 to 2 months apart, because you want to give the first group of cells to do their job. And there's only so much regeneration the body can do in one swoop. So that's when you come back and give it the second wave of repair. This is why I'm not a proponent of, the protocol in Panama, maybe some other places too, where they were giving people 3 injections in 1 week. It makes no scientific sense.
Okay.
Because you just gave them cells, and you want to wait for the cells to start working, to bombard the body all at once. It's not, and I have had a discussion, and really I was, with the, people in the clinic, and I was given no explanation, no sound explanation of why that's a protocol, besides the, I think it may look like a sophisticated protocol and possibly reduce the side effects, because overseas, people go to, all these countries, Bahamas, Panama, Colombia, Mexico,
right.
Cayman Island, they go to all these places and they get huge number of cells. These are expanded cells. So they put the cells in the incubator and grow them to huge numbers. So it's kind of like growing cells on trees. So they can give you huge number of cells. The problem is that those cells have changed in their property. and they are often no longer stem cells. So they've become what's called daughter cell, which is further differentiated, and they've gained all kinds of surface receptors, surface markers that will express the characteristic of the donor.
Gotcha.
That's when you can get a lot of rejection type of reactions, side effects. That's something that never happens, in my treatments, but I've heard that happen quite a bit in the treatments, overseas, where especially sometimes. So first of all, it's broken apart into different, portions, right? 3 sessions in 1 week. If you give so much all at once, there's potential of problems. And that was one reason they were splitting it. Unfortunately, when you split the dose, sometimes you are priming the immune system to recognize that, hey, this is foreign. So by the time you get the second dose, you get a little sicker. And the time you get the third, you get much more sick.
Well, that was what I was thinking as you're sharing that. It just kind of that bit of that pathogenic priming. Your immune system is getting that first exposure, and if you give it some time to deal with it, it might not be too excited the next time you treat it 2 months down the road. I think it goes back to what you're saying initially, is that there's such a incredible complexity just in natural design, and I believe created design, that, hey, let's not try to play God too much here. Let's kind of go,
Yes.
is that kind of where we're at there?
You work with the body. So in the past, they were using 2D expansion. So then all kinds of problems are happening, the cells changing characteristics, because, our body's not 2D. So what did they try to create? They tried to create a 3D structure because there are no edges. And I was thinking, the human body has no edges. Why don't you just put in the human body? That's a great place. And besides, when the cells are in your body, it adapts to the host. I don't know how they do it, but they're able to work with the host. This is why they found that 60% of women carry Y chromosomes in their body, from all kinds of ways, right? From either, when you were in utero, maybe there's a male sibling that you didn't know about, or from sexual intercourse. So they're different ways that these Y chromosomes, these cells, get into women's body. And how do they stay? Why do they stay? Why isn't the body rejecting them?
Right.
Because it's so young and so early, it works with your body. Even human cells can stay for long term, in an animal's body. So once it's in the body, it has a way of adapting.
Very, very interesting. So essentially, it's interesting to me, and I'm again not that familiar with the treatment protocols. You can typically see some pretty positive results within 2 to 3 treatments, typically. And really, I'm not hearing anything, or I've not read anything that shows a lot of real negative side effects from stem cell therapy.
Yeah. So the only problem I've ever seen is when people have a tendency for like a high histamine reaction, they tend to break out with rashes. So these are the people that may break out with a rash, but it's not long lasting. But that's potential, at least from what I'm doing. Other people may have use other types of cells. They may have seen other things, but that's the only problem I have encountered. But I can give them a histamine blocker right before treatment, and that will attenuate that problem.
Gotcha.
But the problems, I think, happens with, if you have an impure product. Definitely we've heard about mishaps from, one of the stem cell companies, and that kind of, I don't know if Livion, and I think 26 people were hospitalized. So it was a big thing. There was FDA recall. The problem is that tarnished the reputation of the whole field, because there are a lot of good companies who are trying to do right things, who definitely don't have contaminations like they do, with E. coli in their product. But then that tarnishes, and that gives the opponents or detractors a great, it's just like a perfect weapon to start talking about unscrupulous, stem cell, practitioners or tissue banks. So even New Yorker, had something about the stem cell profiteers. Like it's great. It's a great weapon to utilize. They wield that around a lot because you have one bad actor. All of a sudden, they're trying to take down the whole field. To me, if you say one practitioner or one lab is producing bad products, it's like, let's say metformin, right? Medicine. A lot of companies are producing this medicine. And there's one company that has contaminated batch and cause a lot of problems. All of a sudden you're banning the whole metformin. Like metformin is no longer allowed because we have one bad manufacturer. I mean, that makes absolutely no sense, right?
Right. Well, and unfortunately, my cynicism kicks in a little bit because a lot of that attack comes from, I think, the protection of the pharmacological kind of approach, where you want to try to squash out anything natural that's going to compete with pharmacology, and
I
so
didn't want to believe that, but I mean, I've been shown again and again, that's the case. I mean, case in point, glutathione, right? A simple antioxidant that's natural in the body. In California, I don't know why we have our mini FDA. We're having trouble getting the glutathione. When is the time that we're going to ban vitamin C, right?
Right.
It's just a matter of time. If they can prevent doctors from getting a simple molecule that can bring so much benefit for people. I mean, that's part of my protocol. And now we're having trouble getting it.
Right.
It makes no sense. Why would anyone try to prevent doctors from getting this natural molecule?
Right.
So that's
and California just has its issues with the law that it's going to kind of hold doctors accountable to the narrative that the government wants to do. That's really sad too. And so, just so I don't go down that rabbit trail too far. When you compare and contrast, for example, and I'll go back to just the musculoskeletal system. The typical option that people face when they're having knee problems and they're entertaining knee replacement or those types of things, steroid injections are typically the way the typical Western model goes, right? So just, I think, for people to understand what is the big difference between a steroid injection into a joint tissue and a stem cell injection. And I was going to follow that up with a couple of other questions, but just kind of in a summary way, what is the big difference there?
Well, big difference is that it's like steroids like a big gun approach that you want to stop the inflammation. So yes, you can temporarily stop the pain, but you're really not treating the underlying issue. And then you're causing all kinds of problems like bone degradation. And, so steroid, is a strong medication. So that's why the effect, wears off and the person can be worse off later on. I compare that as dealing with the devil. So, temporarily, do you want your pain to be less? You want to take this? So you say yes. And then temporarily you're feeling better, but you have to reap all the havoc.
Negative consequence.
So the stem cells has this ability to adapt. I consider that a smart pharmacy. So it's almost like giving intelligence, right? It really is. I mean, injecting intelligence into the body. So the intelligence will say, okay, too much inflammation here, and which means that there can be no regeneration. So let's calm the inflammation down first. It can be helpful, but this is way too much. This is, not going anywhere. So let's calm that down. And also let's remove some of the debris so we can clean things up to make room for new cells. And then talking with the new local stem cells saying, hey, time for you to make some new tissue. All of a sudden you got regeneration. So it's completely, fundamentally different. So there's almost no side effect, but your body's like waking up. So you're giving the intelligence to wake up the body.
And do you find that you've been able to help people avoid, or at least temporarily, or even ultimately avoid knee replacements?
Oh yeah, absolutely.
Yeah,
that's my first patient. You want to know what hooked me in stem cell therapy? I mean, talk about that making this job addictive. My first patient was 69 years old at the time. He was told by 2 orthopedic surgeons that he had to have bilateral knee replacement. So he came to me wanting to save his knees from surgery. So what I did was I injected 1 cc of stem cells into each knee, and I give him an IV treatment of stem cells, because the outer 1/3 of the knee, of the cartilage in the knee joint,
Yep.
is nourished by the blood supply. The inner 2/3 nourished by the synovial fluid. So we want to attack from both angles. And also, when you put stem cells into IV route, it does talk with your spleen, with your peripheral lymphoid system. So it actually tells your immune system what to do. So it has that effect of waking up your own body's ability to repair. So in combination, I always get the best result when you use a combination, especially when a person's older. If a person just had a sports injury, as a young person, under the age 45, we may be able to just do local treatments. But if it's osteoarthritis, which is not a wear and tear disease, is an inflammatory condition that has systemic origin, that is definitely when the IV route is important. So for back to this patient, what's really fun, yes, the knees were fine. I fixed his knee. This is 6 years later, and he's walking 4 miles every day, going to trade shows. He goes to more trade shows than anybody I know, and walking around, no problem, loving it. And what's really interesting was the next day, he said, "Hey, Joy, I slept through the night, and I haven't slept through the night for decades, because he had a car accident. His car rolled over when he was like late teens, and that led to rotator cuff injury, and that never fully healed. So every time when he would turn in his bed in the middle of a sleep, the sharp pain will wake him up. So the next day, he said he slept through the night, and this is 6 years later, he's still sleeping through the night. So the cells found a way, realized that there's a screaming inflammation right there. So let's just get it fixed. So that was remarkable.
And that was via the IV route.
Yeah, I didn't even know about his shoulder problems.
Right.
So talk about feeling like you're a powerful doctor.
That is exciting. What about post knee replacement? Have you had much experience post knee replacement? Because I know with some of my patients, they'll have a decent outcome. It takes some time, but then there's some that just the inflammation doesn't go down. There's problems. I don't know if you've ever worked much with post replacement.
Yes, I have. Yeah. So some people, I think a lot of injuries, from the surgery, scarring tissue, and tendons, ligaments around the area, so that you can help as well to reduce the inflammation, to help with repair and break down some scar tissue. So definitely, I've treated those patients as well.
Okay, and found some positive. How about do you combine any other treatments with the stem cell, like ozone?
Yeah, I love ozone.
Okay.
So we definitely, a lot of times we do an ozone treatment right before stem cell treatment, because I think it's synergistic. You're super oxygenating your body. You're, kind of giving your immune system a boost, with lots of signals, and you're helping the body detoxify. So just increasing cellular energy, right? So I think that's very synergistic. I also use a lot of peptides, which I think are really, really, really exciting. That it's like the new type of medicine. I do think that in, I don't know how long, 2050, depending on how much resistance there is from the establishment. But one day, I think peptides are going to replace 50 to 70% of medications we have, because there's no reason to be using all these artificial medications when your body already have the signals, knows exactly what to do. We've all heard of cases of spontaneous remission, right?
Yes.
And what's going on there? That means your body has all the tools.
Right.
And if you just send the right, somehow the pathway is set up right, all the right signals will promote healing. So that's what we're counting on in peptide therapy. So peptides are really powerful, so targeted. So I love utilizing that with patients. So if a patient has immune issues, we have peptides to boost the immune system. With muscular skeletal issues, we can use peptides to promote musculoskeletal healing. And the brain, there are brain peptides, there are peptides help with sugar, your metabolic syndrome, weight loss, and, growth hormone production, and skin regeneration, hair regeneration. So it's so fun. So I do incorporate depending on what the patient needs.
Very, very good. And what about like platelet-rich plasma or those types of things, prolotherapy? Are those in that kind of conversation?
Yeah, I do use PRP, platelet-rich plasma. So I often do it with local injections. So I, put the stem cells into the PRP I get from the patient. That provides nourishment for the cells and has its own benefits because of all the growth factors it contains.
Gotcha.
And also provide some more volume. Sometimes I like the cells to be able to travel in tissue layers. So that provides some more volume, allow the cells to diffuse better.
Gotcha. Very good. Very good. So any other, things that you have found beneficial with stem cell therapy in general? I know it's exciting, the future looks great. And unfortunately, hopefully it won't take 20 or 30 years for the tide to shift a little bit more, but any other just general thoughts there?
We'll keep biohacking. So maybe we'll have a lot of time to wait. I think for stem cells, people come to me with all kinds of issues, right? Some are obscure, some are conditions that no one has ever done research on. So then my job is to analyze what's causing your problem in the first place. So let's, figure out the pathophysiology. If I always say, if there's inflammation and immune dysregulation as part of the pathology, if that is part of the picture, then that's exactly what these stem cells can do, because it can reduce the inflammation, of course, tissue damage, it can promote tissue regeneration, and it can get your immune system to a more balanced state. So that's kind of my guiding principle. But even genetic defects, right? People with genetic mutations, I can't fix your genes without gene therapy, but the gene itself doesn't cause damage. It's the downstream tissue dysregulation, right? The tissue gets damaged, and that's when you present with pathology. So then stem cells can come in, repair the tissue. That's a downstream sequelae. So that's what we can do. We can go at the level of the damage. So that's which it offers a lot of people hope.
A lot of good hope. So I think maybe another time I want to maybe come back and see if we could have a conversation again, but given the time considerations, I might hold off on ketamine because I'd love to go down the ketamine road a little bit further than we may have time for today.
Yeah, sure.
Maybe just a surface, what are you doing with ketamine and some of its applications, and then we'll kind of go from there.
Yeah, so ketamine it's really exciting to me because with stem cell therapy, I can help repair the body, help regenerate the tissue, but I'm not touching the wiring of your brain.
Neurogenesis.
Yeah. So neurogenesis, I may be able to, regenerate some neurons, but the communication between the neurons and the wiring, I think that, that comes to, question of consciousness and thought. How is that formed? How can I change that? I can't change it with stem cell therapy. There's limitation in that regard, but ketamine therapy can come in and it rewires the brain. This is the part that's so exciting. The fact that I was a psychiatrist for 11 years, I've spent 4 years at the VA hospital. I've treated so many veterans with PTSD, and that is one of the most difficult condition. Everyone agrees, no matter how much therapy I give patients, and medicine, can't even touch it. It just touches the surface symptoms, get the person to be less depressed and sleep a little better. But psychotherapy barely touches it. You can make the person adapt a little better to their symptoms, but it does nothing to the actual hypervigilant response, that this sympathetic overactivation. You can't touch it. But with ketamine therapy, you can, sometimes with very few treatments. To me, that is unbelievable having
Right.
struggled for years and years. I can do weekly therapy. It barely touches it. And within, a few sessions, the person can get over the trauma, realizing, okay, so it happened, but doesn't mean that I have to live in that trauma forever, right? Life goes on, life moves on. So we all have bad things happen. That doesn't mean that you stop living. So that's what happens with ketamine, that it bypasses the trauma, gives you a different perspective. I don't know how it does that, but that goes to a whole other realm, that, things that we don't really understand, and which should be the new frontier of medicine, even
Right.
though it touches upon spirituality. But I think spirituality should come into medicine, or medicine should go into spirituality. That's, you need to, and that's part of human existence.
Yes.
If you're true medicine, you tap into every aspect of human existence.
Yeah.
You enhance wellness for every aspect. So ketamine, not only, promoting tremendous brain-derived neurotropic factor, secretion, helping regenerating, increasing, dendritic spine, the new synapses,
Synapse connections.
Yeah, but also when people are under ketamine, they found out that their brain waves are very similar to a high monk who have had, probably decades of meditation under their belt. And it has a similar state, because these high monks will get into this high gamma wave activity. And the ketamine can get you there. Compared to regular meditation, you just get a lot of alpha waves, you get more relaxed. But when you actually are under ketamine, you get into a whole other state. So that, I think, is part of the answer of why it works. So we need to go beyond the receptors. I'm so sick of people talking about the receptors, because I think the answer lies beyond the receptors.
Yeah, and it gets into that kind of, how complex is it? We really have only scratched the surface. And prayer and meditation, there's been quite a few studies on prayer and meditation, and it's very positive impact on health. And so, why is that happening? And ultimately, if you believe there's a supernatural, that is what it is, and the spirituality aspects of that. But ultimately, there's a physical reality, and it's whatever we're exposed to has an impact on how our physicality responds, right? And that includes brain tissue and neurons and things of that nature. I always tell people we're a learning system, that we're learning 24/7 all the time. And whatever we teach it, directly or indirectly, the body's just going to continue to learn. And so if we give it bad habits, it's going to keep learning the bad habits. If we give it good habits, it's going to keep. And I know that has an impact on the brain tissue as well.
Yeah. And I tell people everything is important. The physical and the spiritual are important. Have you seen those gurus with a big belly and have diabetes, have all kinds of problems, right? So some are in great shape, but some are really not in very good shape with heart diseases. So because maybe they don't care. But if they had cared a little bit more, they could have lived longer. They could have contributed more to the world.
Right.
Do you want to want to live longer and contribute more and experience more? So that's the personal choice.
Yeah. And have the at least at the very minimum, have a quality of life that allows you to engage more, with the world, and it does give you potential for a longer life. I tend to, from my faith base, I tend to believe that those days are already numbered, but now I still have a chance to live them quality wise. So,
well, we'll see. Things are changing fast. So we'll see.
Yeah. It's very exciting. Boy, so much more I'd want to kind of get into. Why don't we let us know? I know you've got some products that you've developed. Why don't you share just a little bit about that?
So the stem cell products, which are really exciting. So we do have products for, as injectables. So we do send it all over the country to different physicians. And it's very exciting to hear all the success stories from doctors. So besides that, I also developed a skincare product, which really was not I never even thought about skincare for anybody else but myself before. I didn't go into medicine to help with, to look prettier. I just, I wanted to heal people, but I do want to, continue to have good skin, right? Continue to look good. We
Sure.
all want to look good. And, men the same way. You guys are no
Sure.
exception. I know that.
Right.
And so I just wanted a good product on my face without toxicity, and I couldn't find it. It's really difficult. And to have a decent product that's stable, that actually is all natural and
Non-toxic.
yeah, a lot of products say they're all natural until you flip over and read ingredients. So I got frustrated, because I couldn't find one. So I realized that I have access to some of the best ingredients, including stem cells and the peptides. So that's when I decided, okay, I'm making an all natural product, period. There's no compromise. Even the preservative is going to be all natural, even though that's going to give me a shorter shelf life.
Right.
I'm willing to do that. So this is called Chara Omni. So Chara is actually, that's the name of the company, right? Chara Biologics. Chara is the Greek word for joy, which is actually a very beautiful meaning of joy. But Chara Omni, this is like 100% natural product that's very deep penetrating. So people don't need to use toner or serum or separate eye cream. I just think those are very gimmicky. You really should put the best ingredients into everything. You don't just put special ones for the eye. So for me, I call my cream is like eye cream for your entire face and neck. I'm just I'm giving you the best for everything, and big quantities, not like little teeny bitty for just for your eye. So it's all in one. So there's no need to buy all these separate products. It penetrates deeply, and it's 100% natural. So we've got all these stem cell components. Cells are not alive, but all their beneficial growth factors and signals are still in the product, and all these peptides and lots of natural herbal extractions and antioxidants and prebiotics. So it's a pretty exciting. People absolutely love it. So, and I use it every day.
Very good.
For the last 3 years. Yeah.
Well, and you look great, and I know your heart and work that you're doing is going to obviously continue to bless a lot of people. So Chara Biologics is one place to follow up with you and Uplift Longevity.
Yeah, probably Uplift would be more for for everybody who may be interested in looking at some of these cutting edge treatments, whether or not a stem cell treatment, exosome treatment, or peptides. So Uplift with the Y. So it's Uplift Longevity Center. The website is upliftcenter.com. Yeah, so I'm excited to help more people.
Great. Well, thank you for sharing with us. I'm blessed, and I know that our listeners will be blessed. So really appreciate you taking the time to share all this good information.
Oh, thank you for a great conversation.
Awesome. Hey, everybody, have a blessed day.